Well, malaria is spread to humans through some mosquitoes. It kills mostly children. In 2021, nearly half the world's population was at risk of the disease. There were 247 million cases of malaria worldwide, causing nearly 620,000 deaths. Now, Africa carries a disproportionately high share of the burden of malaria. Children under 5 accounted for 80% of all malaria-related deaths on the continent in 2021. The pandemic contributed to a further rise in malaria cases. During the height of the COVID-19 outbreak, disruptions led to nearly 13 million more malaria cases and 63,000 more deaths, with the African continent once again bearing the brunt of the cases. Lottie Renwick, Senior Policy Advocacy Advisor at Malaria No More UK, spoke to Jamie Owen.
This is so important because, as we've just heard with some of those stats, a child dies from malaria every single minute. So the addition of this second malaria vaccine means that we're able to extend the reach of malaria vaccines to tens of thousands more children. And by adding it on top of our existing malaria interventions that we already have, we really hope that we can get back on track to actually ending malaria in our lifetimes.
And that's the point, isn't it? This isn't a single bullet, it's part of a toolkit.
Exactly. So malaria is really complicated. It really depends on the context, on the country, what sort of tools you need. And the way these vaccines have been tested is in conjunction with other malaria tools, such as bed nets, such as drugs. You always need the diagnostics as well to be able to diagnose malaria. So when used in conjunction together, we really hope it could have a big impact.
It's heartbreaking always to look at those figures, but it's the most vulnerable, the children around the world, who are most at risk, isn't it?
Yes, exactly. It's children under 5 that are most at risk. And so something like this vaccine could really help, and that's who it's going to be given to, children under 5. But what we really need to see now is commitment towards the funding of both this vaccine and the other interventions, because they will be rolled out together. And to do that, we need to see governments really committing to funding organisations such as Gavi, the Vaccine Alliance, but also the Global Fund as well.
What's the time frame? What are we looking at? I mean, how long is it going to take for this to be distributed and have an impact?
So we're really hopeful. The manufacturers said that by the middle of next year, they may well be able to start producing up to 100 million doses, as you said earlier. We're just waiting on one more kind of step from the World Health Organization called pre-qualification. And then that will mean that Gavi, the Vaccine Alliance, will be able to start rolling out the vaccine once the manufacturer has got the green light as well.
Well, I'm guessing every month delay has pretty grim consequences.
Yes, exactly. So really, the World Health Organization has really done this as quickly as possible, which has been brilliant to see. And because we already had that existing malaria vaccine, it should be much quicker to roll out this next one.